Hello, it's Dr. George Hill, and we're going to talk today about the appropriate use of the 25 modifier in reproductive endocrine and infertility practices. This is a topic that all of us need to be aware of, and as we go through this, I hope that you'll see why this is important, that all of us know how to use this modifier correctly in our day-to-day practice. Let's first begin by talking about what CPT modifiers are. The CPT modifiers are two-digit extensions of a CPT code that indicate that a service or procedure that has been performed has been altered by some specific circumstance but not changed in its definition or code. I think it's also important that we remember that these modifiers describe services rendered. They are not risk categories, and what they really state is that there is a significant or unusual variation in the code terminology. We also want to realize that this should not in any way be used for a routine increase in the fees that you collect for those procedures. So let's look specifically at Modifier 25. If you look up Modifier 25 in the CPT book, you'll see that it states that this is a significant separately identifiable evaluation and management service by the same physician on the same day of the procedure or other service. If we look at it a little bit closer in CPT, they go on to say that it may be necessary to indicate that on the day a procedure or service was performed, the patient's condition required a significant separately identifiable E&M service above and beyond the other service provided or beyond the usual preoperative and postoperative care associated with the procedure that was performed. Let's also remember that all of the procedures that we perform do have some amount of evaluation and management service already built into the value of that procedure. CPT goes on to say that a significant separately identifiable E&M service is defined or substantiated by documentation that satisfies the relevant criteria for the respective E&M service to be reported. It's also important to remember that different diagnoses are not required for reporting of the E&M service on the same date. The E&M service may have the same diagnosis as the procedure, or they may be different diagnoses. If we look at this definition a little bit closer, let's first talk about what might be meant by significant. Well, I think all of us would agree that if you're reporting a low level of service with a procedure, some might question whether or not this was really a significant evaluation and management service beyond what's typically included in the E&M service for that procedure. So again, take a look at what your coding and documentation require, and if you are coding something at a very low level of service, this may not be significant enough to warrant the use of this modifier. It also needs to be separately identifiable. The E&M service actually may be for a problem that's related to the procedure, or it may be unrelated to the procedure, but most importantly it needs to be separately documented from the procedure itself. In terms of documenting the E&M service, we want to separately identify that service, including the history that was performed on that date, any physical exam that might have been performed, the medical decision making that was required, or if time is the means by which you're coding your E&M service, that time should be documented. Likewise, we should have a separate operative note in the record discussing the procedure that was performed. This should include the preoperative diagnosis, the postoperative diagnosis, the procedure that was performed, any anesthesia that was used, and then a description of the procedure. Let's take an example as we think about how we put all this together. If you have a patient who comes in who has, for instance, irregular bleeding, and you perform an evaluation and management service to evaluate that problem, and in the process of evaluating that problem, you decide that that patient needs an endometrial biopsy, you then go ahead and perform that endometrial biopsy, then you have performed both an E&M service and a procedure on the same date. In that circumstance, we would report the E&M service, we would add the -25 modifier to the E&M service, and then we would also report the correct CPT code for the procedure that was performed. So I think if you keep all of these concepts in mind when you evaluate a patient and perform a procedure on the same day, then your documentation and coding are going to be accurate, the denial of these claims should be less, and the reimbursement should be appropriate for all the work that you have performed for the patient on that data service, including both the E&M service and the procedure. Thank you so much for taking time to listen to this discussion of Modifier 25.